Have you ever wondered what gases are used for anesthesia and how they work? Well, you're not alone. Anesthesia is a fascinating field of medical science that has transformed the pain experiences of countless patients since its inception. Back in the day, surgeries were a horrifying ordeal, often leading to unbearable pain and discomfort. Then came the advent of anesthesia, a revolutionary breakthrough in the late 18th century that changed the game forever. This remarkable discovery made it possible to perform complex surgeries with patients feeling little to no pain, transforming the world of medicine as we know it. Anesthesia gases play a crucial role in this process. They induce a state of controlled unconsciousness, allowing surgeons to operate without causing distress to the patient. From dental procedures to major surgeries, anesthesia has made the seemingly impossible possible. Now that we understand the importance of anesthesia, let's dive into the types of gases used and how they function. One of the most commonly used gases in anesthesia is nitrous oxide, also known as laughing gas. This colorless, non-flammable gas, with a slightly sweet odor and taste, has been a significant player in the field of anesthesiology for over 2 centuries. Nitrous oxide was discovered by English chemist and natural philosopher Joseph Priestley back in the late 18th century. However, its potential in pain relief wasn't recognized until the mid-19th century by an American dentist named Horace Wells. Wells observed that people under the influence of this gas seemed impervious to pain, a trait that proved to be revolutionary in the realm of surgery and dentistry. So how does nitrous oxide work, you may wonder? Well, it's all about the interaction with our nervous system. Nitrous oxide is a weak anesthetic agent, which means it doesn't completely knock you out like some other gases. Instead, it induces a state of analgesia, or pain relief and sedation. It achieves this by inhibiting certain neuronal signals in the brain that perceive pain. It's like turning down the volume on the pain signals your body sends to your brain. But that's not all. Nitrous oxide also has a unique quality that sets it apart from other anesthetic gases. It's a potent vasodilator, which means it can expand your blood vessels, allowing for greater blood flow. This ensures that the drug is distributed quickly and efficiently throughout the body. However, it's crucial to remember that nitrous oxide isn't a one-size-fits-all solution. It's usually used in conjunction with other anesthetic agents to achieve the desired level of sedation and analgesia, particularly in more complex or lengthy surgical procedures. To sum it up, nitrous oxide, or laughing gas, has played a pivotal role in advancing anesthesia. It's a gas that can take the edge off pain and anxiety without causing total unconsciousness, making surgeries and procedures far less daunting for millions of people worldwide. So nitrous oxide, a simple gas, has a profound effect on our perception of pain and consciousness. Another important gas in the world of anesthesia is isoflurane. Let's dive into the fascinating world of isoflurane. This colorless, volatile liquid has a sweet, pungent odor and is widely used as an inhalation anesthetic. When it comes to general anesthesia, isoflurane is often the go-to choice. What makes isoflurane special, you ask? Well, it's not just about knocking you out for surgery. Isoflurane is a potent anesthetic, yes, but it's also a muscle relaxant. It has the ability to relax your muscles, making it easier for surgeons to operate. Now, how does isoflurane work in the body? It's a bit like a fancy lock and key mechanism. Isoflurane molecules act like keys, fitting into specific receptors in the brain, the GABA receptors. When these keys turn, they increase the effects of GABA, a neurotransmitter that inhibits the transmission of nerve signals in the brain. This ultimately reduces sensation and consciousness, allowing you to undergo surgery without feeling a thing. But isoflurane doesn't just stop there. It also has effects on the heart. It can slow the heartbeat and reduce blood pressure, which can be beneficial during certain surgical procedures. However, these effects also mean that isoflurane must be used with caution in patients with heart conditions. It's also worth noting that isoflurane is metabolized minimally by the body, with less than 1% being broken down in the liver. This makes it a safer choice for patients with liver disease. However, like all anesthetic gases, isoflurane does have potential side effects, including nausea, vomiting, and changes in blood pressure. Despite these potential side effects, isoflurane has been a mainstay in the world of anesthesia since its introduction in the early 1970s. Its ability to provide a smooth and rapid induction of anesthesia, combined with its muscle-relaxing properties, make it a valuable tool in the anesthesiologist's arsenal. Isoflurane, a potent gas, plays a critical role in ensuring a pain-free surgical experience. Next up is sevoflurane, a modern marvel in the world of anesthesia gases. Sevoflurane is a sweet-smelling, non-flammable, highly fluorinated methyl isopropyl ether used for induction and maintenance of general anesthesia. While it shares properties with other anesthesia gases, the unique characteristics of sevoflurane set it apart. One of the key advantages of sevoflurane is its low blood gas partition coefficient. You might be thinking, what does that mean? Well, this property essentially means sevoflurane is highly soluble in blood. This allows it to be rapidly taken up and released by the body, resulting in quick induction and recovery times for patients. It's like the express train of anesthesia gases, getting you where you need to go in record time. Another advantage of sevoflurane is its ease of administration. It can be delivered at low concentrations, making it ideal for patients with respiratory issues. This is a significant benefit over gases like isoflurane, which can cause respiratory irritation. Now, how does sevoflurane work? Like other anesthesia gases, sevoflurane acts on the central nervous system, but it does so in a slightly different way. It enhances the activity of certain neurotransmitters in the brain, essentially turning down the volume of the nervous system. It's like a dimmer switch for your brain, allowing doctors to adjust your level of consciousness with precision. Sevoflurane also has a unique ability to protect the heart against ischemia, a condition where the heart muscle doesn't get enough blood. This makes it a valuable tool in surgeries where there is a risk of heart complications. But it's not all sunshine and rainbows with sevoflurane. It can cause a slight drop in blood pressure and may not be suitable for all patients. But, with careful monitoring and dosage adjustments, these effects can be managed effectively. Sevoflurane, a quick-acting and easily adjustable gas, provides a smooth induction and recovery from anesthesia. It's a perfect example of how advancements in medical science continue to improve patient care, making surgeries safer and recovery times faster. The last gas we will discuss is desflurane. Desflurane is a fascinating player in the world of anesthesia and has its unique narrative. This gas is a colorless, non-flammable liquid at room temperature, but the magic happens when it's heated up and vaporized for use in anesthesia. You might think of it as the steaming pot of the anesthetic world. Desflurane is used in general anesthesia, often for surgeries that require a quick recovery. It's a heavyweight when it comes to rapid onset and offset of action. This is because desflurane has a very low solubility in blood, which allows it to be quickly eliminated from the body. This means that patients wake up faster after surgery, a factor that can be critical in certain situations. But how does desflurane work in the body to induce anesthesia? Well, it's all about the interaction with the brain. Desflurane alters the activity in the central nervous system, effectively dulling the brain's response to pain. It does this by enhancing the inhibitory function of the neurotransmitter GABA, which reduces nerve excitability. This is a common mechanism of action for many anesthetic gases, but desflurane does it with a unique finesse and speed. However, it's not all sunshine and roses with desflurane. This gas has a strong, pungent odor, which can make it less suitable for induction of anesthesia, especially in patients who are awake. It can cause airway irritation, coughing, and breath holding, which are not exactly the ideal start to an anesthetic experience. But despite its pungency, desflurane has some unique advantages. Its rapid onset and offset make it an excellent choice for day surgeries or procedures where quick recovery is beneficial. It also has less impact on the environment compared to some other anesthetic gases, which is a plus for our planet. Desflurane, although less commonly used due to its pungency, has its unique advantages in certain clinical scenarios. So next time you're in an operating room, give a nod to the steaming pot of the anesthetic world, desflurane. Having discussed these gases, let's compare them side by side. Nitrous oxide, isoflurane, sevoflurane, and desflurane all have unique properties making them suitable for different applications in anesthesia. Let's delve deeper into the comparisons to better understand their roles. First up, nitrous oxide. It's often used as a supplement in general anesthesia due to its analgesic properties. However, its low potency requires it to be mixed with other gases or administered at high concentrations. It's also known for its rapid onset and recovery times. Next, isoflurane. This gas is renowned for its potency and muscle relaxation benefits. It's often used in general and neurosurgery anesthesia. However, its slow onset and recovery times make it less desirable for short procedures. Sevoflurane, on the other hand, is a favorite for pediatric anesthesia due to its pleasant smell and non-irritating properties. It also has a rapid onset and recovery time, making it ideal for outpatient procedures. But it's not as potent as isoflurane, meaning it may need to be supplemented for certain surgeries. Lastly, desflurane. This gas has the fastest onset and recovery times of them all, making it perfect for day surgeries. However, it tends to irritate the airways, which can cause coughing or breath holding, particularly in children or non-intubated patients. In terms of mechanisms, all these gases work by depressing the central nervous system, leading to a loss of consciousness. However, they do this at different rates and to varying degrees, which plays a big part in their specific uses. As for their relative advantages and disadvantages, it's clear that no single gas is the best. It all depends on the specific needs of the patient and the procedure. Factors such as the duration of surgery, the patient's health status, and even the anesthesiologist's experience and preference come into play. As we can see, each gas has its unique properties and uses in the world of anesthesia. So, we've taken a journey through the world of anesthesia gases. We've explored the fascinating realm of nitrous oxide, a gas often referred to as laughing gas due to its euphoric effects. We've learned that it's been a reliable companion in the medical field for over a century, helping to numb pain and make procedures more comfortable for patients. Next, we dove into the world of isoflurane, a potent inhalational anesthetic. It's known for its stability, safety, and swift induction and recovery times. We've learned that isoflurane is not just a tool for anesthetists, but also a key player in critical care and veterinary medicine. Then, we moved on to sevoflurane, a modern marvel in the field of anesthesia. We've discovered its remarkable characteristics, like its low blood gas solubility, which allows for rapid induction and emergence from anesthesia. It's also noteworthy for its minimal irritation to the airway, making it a preferred choice for mask induction, especially in children. We didn't stop there. We also ventured into the realm of desflurane. This gas, though similar to sevoflurane, has its unique features. It's the volatile anesthetic of choice for day case surgeries due to its ultra-rapid emergence and recovery times. However, its pungent odor and airway irritation make it less suitable for mask induction. Lastly, we compared these anesthesia gases, highlighting their unique properties, advantages, and limitations. Each gas has its own niche, meticulously crafted by decades of research and clinical trials. They all play their part in ensuring a smooth and safe anesthesia experience for patients. Understanding these gases not only demystifies the process of anesthesia, but also highlights the incredible advances in medical science. Remember, knowledge is power.